right, welcome back to Dr. Moses' YouTube channel. And on today's episode, we want to discuss the topic acute back pain, chronic back pain. And the question is, do muscle relaxant really work when you have an acute back pain? Now, over 33% of people living in America will have, a back pain at one time or the other, either through an injury or just not just sitting for a long time, or sometimes in a car accident or something like that. People have acute back pain, and sometimes the pain is in their lower back, and they may have radiation of the pain down their legs. And if you had a back pain before, you know that it's no joke. Sometimes you feel like you're dying. And most of the time, when you go to see the doctor or you go to an urgent care, they may prescribe, different medications for you, or they may tell you to use ice and heat, and which has modality on how they function. Ice will take the pain away, the heat will relax the muscle, but sometimes it takes a long time for this pain to go away. The question we are discussing today is, do muscle relaxant really work for acute back pain and also for chronic back pain? Let's dive into it. There are several muscle relaxant like baclofen, um, carisoprodol, cyclobenzaprine, methocarbamol, tizanidine, and sometimes physicians will even prescribe benzodiazepine. Okay. And so the question is, do these common muscle relaxants that are prescribed, do they work? Now, how do they work? Muscle relaxants, they act on the central nervous system and suppress the nerve signal that really trigger muscle contractions, and therefore people start experiencing, muscle pain. So the question is that, do they really work or not? Now, when you have acute back pain and you are experiencing spasms in your back and you're experiencing muscle contraction, and then muscle relaxant will work. There have been several studies that have shown that if you have back pain and you have contractions and you have spasms, then if they prescribe muscle relaxant for you, then they will work. But usually they work for a very short time, up to about 2 weeks, at most 3 weeks. And then the effect of that is no longer, the efficacy is very, very, very low. There was a randomized control trial that was done in 2017, published in the PubMed, and also I think the New England Medical Journal also actually wrote about the same article, where they actually randomized. There was about 49 trials, and out of the 49 trials, they have about 31 of those, and there were almost over more than 6,500 patients were actually randomized to see if giving them muscle relaxant versus just a placebo, if there'll be an effect or not. And after several weeks of the trial, they found out that those who took muscle relaxant during the acute phase of their back pain with spasms and with contractions, they did experience some relief of the pain as compared to the control or to the ones that were given a placebo. So there is some benefit if you do have spasms and you're in an acute phase of your back pain. However, if you don't have spasms or you don't have any contraction of your back, then muscle relaxant really will not be very beneficial to you. And I think that most physicians need to be very upfront and honest with patients and let them know the effect of this muscle relaxant. Now, there is a side effect to the muscle relaxant. You can have dry mouth, drowsiness, a lot of sleepiness. Sometimes people feel very dizzy. So a lot of side effect is associated with with all this muscle relaxant. So when I see patient on muscle relaxant for years, it kind of bothers me because I work from the ER and also in the hospital. And so when I see patient on muscle relaxant for over months for acute back pain, it bothers me. And also, if I see patients that are on muscle relaxant for fibromyalgia, just generalized pain without any spasms and contraction, that bothers me because of the long-term side effect and also the fact that they don't really work. Now, what about chronic back pain? Do they work? Chronic back pain? Well, there have been I think in 2021 there's a study here that was done, and they find out that people. Look at a study here. So the study can be found. Actually, I'll leave the link below here. And the long-term use of muscle relaxant is only effective in certain conditions, like if you have cramps, chronic cramps, and chronic spasms, or you have chronic neck pain. They have found out that if you use muscle relaxant in those cases, you'll get some benefit from it. So, what is the take home on muscle relaxant and acute back pain? Now, if you do have acute back pain and you do have spasms with it, you have a lot of contractions and your muscles are very stiff, then the muscle relaxant will help the first 2 to 3 weeks, short-term use only. Don't go beyond that because it's not going to really help you. Instead, you have more side effect to it. Or if you do have chronic spasms and chronic contractions or neck pains, then the study that has been done, this was published by the University of Yale. Actually, they've published that people who have these conditions can have benefits using long-term muscle relaxant. So this is the effect of muscle relaxant on back pain. And if this video has been very helpful to you, I want you to subscribe to my channel, share the video, and also give me a like. And also, I want you to leave some comments if you've had back pain, you're experiencing that, and some things that have worked for you so that our audience will benefit from it. So again, on the next video, we want to talk about corticosteroids and muscle and back pain in our next video. And so until then, I will say this is Dr. Moses, and you stay well.